The Qualified Bilingual Staff Program was created in order to eliminate and remove barriers to care to some of our patients that are limited English proficient. We train these employees on proper interpreting in a medical facility. We're not really teaching other languages, but what we do teach is the interpreting piece. The where to position yourself, how to really promote a patient-provider relationship. We talk about medical terminology. We talk about ways to remain transparent, again, in a physician-patient interaction. We are blessed to have so many individuals and employees from so many different countries, and also individuals that are fully bilingual in other languages in addition to English.
I believe it's helped a lot of patients and a lot of people that really feel lost. A lot of times they don't know how to communicate with staff or with the physicians and have concerns about medications or about diet, about all nursing situations, anything. So when I go to the rooms and I interpret for them, to them it's like the heavens opens up.
I came here when I was 17, and I was going through not only adolescence, going through teenage years and with a culture shock. And on the top of that, I was experiencing some language barriers, so I can kind of understand how difficult it is to not to be able to communicate.
We go to patients that speak Spanish, and we ask them questions of how they feel here, if there's anything else we could do for them. And I'm able to help them, let us know what their needs are here in their own language.
Some examples that I can give you, particular on about improving the cultural competence of our hospitals in particular, is when you walk into our reception and you see some of those blue phones with two hands. I've seen many patients go straight to the reception areas, and if they don't speak English well, basically all they have to do is grab one of those phones, and it immediately calls an interpreter call center in which they tell them what language do they speak, and immediately an interpreter comes up. Then the provider holds the other line, and they'll be able to talk to each other. Another great example is, and we've seen a great improvement in this, is caring for our communities that are deaf or hard of hearing. One of the technologies that we're using currently is we have these phones that you open them up and it has a computer screen. The minute you open it up and press the button, it calls a call center in which a live person comes, and then they can sign to the patient, but they can also hear the provider, and whatever the provider is saying, this person on the TV monitor is signing to the patient. The patient signs back, looking at the little camera and the monitor, and then the interpreter on the phone, which with the computer screen, speaks to the provider and let them know what the patient is saying. Again, it's a great way to improve how quickly we provide quality care, but also reduce the anxiety, and the provider as well as the patient feel confident that they're truly understanding each other.